The Affinity Diagram, also known as the KJ method, is a powerful tool for organizing and making sense of large volumes of information. Developed by Jiro Kawakita in the 1970s, this method has become a staple in problem solving and decision making across industries. Its strength lies in its ability to help teams uncover hidden patterns, identify themes, and prioritize areas for action, all from a seemingly overwhelming amount of data. On screen is a copy of the AI-powered Strategic Thinker 3 Kindle edition, so we can copy the prompt into ChatGPT. On the right is AI-powered Strategic Thinker GPT, which is optimized for this tool and others in the book. You will want to start with the first prompt and provide context for your organization in the brackets. It may also be beneficial to upload documents related to your work. Prompt: act as the staff to your organization name. Your job is to synthesize the following context to assist in performing the 6 empathetic questions. Context is in brackets. If you understand your task, your only response is 3 dots. For this purpose, I've prepared a prompt that will make up an organization, but search the web for a real-world problem we can look at in this example. The prompt states, I need a hypothetical company from the nursing industry. Search the web and find a real-world problem the industry has not been able to solve. Provide an overview of the problem and wait for the next step. After the initial prompt, there are 2 additional prompts executed in this video. They are: 1, gather a diverse group of stakeholders or team members to participate in the process. List and describe who is on your team. 2, brainstorm and list 40 ideas, issues, or problems related to the topic at hand. 3, write each idea on a separate index card or sticky note. If you are actively making an affinity diagram, you can use the ideas generated in step 2. In ChatGPT, you can skip this step if you want. It will likely repeat the 40 ideas. 4, post all of the cards or notes on a wall or large board. In ChatGPT, you can skip this step if you want. 5, move around the cards or notes and group similar ideas together. List each group and the cards or notes within that group. 6, use the resulting groups and themes to identify patterns, priorities, and opportunities for further analysis or action. List each pattern, list the priorities, list the opportunities. Next, provide recommendations for further actions. Last, I added a prompt, not in the book, but wanted to see what ChatGPT would come up with. The prompt is, draw the affinity diagram you just created. Now we will go ahead and show you an example in action.
Hypothetical company. NurseCare Innovations, Inc. Overview of the problem. The nursing industry is currently grappling with a significant and persistent challenge, the widespread shortage of nursing professionals. This shortage has been a long-standing issue, with roots tracing back several decades, and has been exacerbated by recent global events, notably the COVID-19 pandemic. Key factors contributing to the nursing shortage: increased demand for healthcare services. An aging global population has led to a surge in healthcare needs, thereby increasing the demand for nursing services. This demographic shift has placed additional pressure on healthcare systems worldwide. High rates of burnout and job dissatisfaction. Nurses often face demanding workloads, extended hours, and emotionally taxing environments, leading to burnout. A 2023 survey highlighted that a significant number of nurses reported feelings of emotional exhaustion and burnout, contributing to high turnover rates within the profession. American Nurses Association. Inadequate compensation and benefits. Despite the critical nature of their work, many nurses receive compensation that does not reflect their responsibilities and the challenges they face. This disparity has been a deterrent for both current professionals and potential entrants into the field. Educational bottlenecks. There is a notable shortage of nursing educators, which limits the capacity of nursing programs to admit and train new students. This bottleneck hampers the ability to replenish the workforce at a pace that meets growing demand. Workplace safety concerns. Nurses are at risk for workplace violence and abuse, often perpetrated by patients or their families. In the USA, a significant percentage of nurses have reported being threatened or physically assaulted at work, leading to increased stress and job dissatisfaction. Wikipedia. Impact on healthcare delivery. The nursing shortage has profound implications for patient care and the overall efficiency of healthcare systems. Compromised patient safety. Inadequate nurse-to-patient ratios can lead to increased medical errors, longer hospital stays, and higher mortality rates. Increased operational costs. Healthcare facilities often resort to hiring temporary staff or paying overtime to existing staff, leading to escalated operational expenses. Delayed care delivery. Staff shortages can result in longer wait times for patients, delayed procedures, and overall reduced access to healthcare services. Addressing this multifaceted issue requires comprehensive strategies that encompass workforce planning. Educational resources. To address the nursing shortage effectively, a multidisciplinary and diverse team of stakeholders is essential. This ensures the problem is approached from various perspectives, encompassing healthcare, education, technology, policymaking, and workforce management. Below is the team roster with a description of each member's role and expertise. 1. Role, leads nursing operations within healthcare organizations. Expertise, deep understanding of the nursing workforce, challenges faced by frontline nurses, and the operational intricacies of hospital staffing. Contribution, provides first-hand insights into workforce issues and suggests practical solutions for improving job satisfaction, retention, and patient safety. 2. Human resources specialist in healthcare. Role, manages recruitment, training, and employee retention strategies for healthcare organizations. Expertise, workforce planning, employee engagement, and organizational culture. Contribution, develops innovative hiring strategies and identifies solutions to minimize burnout and turnover among nurses. 3. Nursing educator or academic. Role, an experienced professor or leader from a nursing school. Expertise, curriculum development, nursing education pipeline, and student recruitment. Contribution, identifies ways to address educational bottlenecks, including training more nursing educators and increasing student enrollment capacity. 4. Role, specializes in technology solutions tailored to the healthcare industry. Expertise, AI-driven workforce management tools, telemedicine, and innovative patient care technologies. Contribution, proposes tech-driven solutions like AI scheduling, training simulations, or telehealth platforms to reduce nurse workload and improve efficiency. 5. Role, a representative from public health or labor departments. Expertise, healthcare policy, funding, and regulation. Contribution, advocates for systemic changes, including incentives for nursing education, increased funding for hospitals, and policies that support nurse safety and well-being. 6. Role, a practicing nurse actively involved in patient care. Expertise, real-world challenges in daily nursing practice, including workload management and patient interaction. Contribution, provides an authentic perspective on what motivates or deters nurses and suggests practical workplace improvements. 7. Role, oversees the strategic direction and operations of healthcare facilities. Expertise, budgeting, resource allocation, and patient care delivery systems. Contribution, aligns proposed solutions with organizational goals and ensures financial feasibility. 8. Role, advocates for nurses' rights and workplace conditions. Expertise, collective bargaining, labor laws, and nurse advocacy. Contribution, ensures proposed solutions address key issues like compensation, workplace safety, and fair scheduling. 9. Role, represents patients' perspectives and experiences. Expertise, advocating for quality care and understanding patient needs. Contribution, ensures solutions maintain or enhance patient care standards while addressing nurse shortages. 10. Role, specializes in analyzing healthcare workforce data and trends. Expertise, statistical modeling, trend forecasting, and industry benchmarking. Contribution, provides data-driven insights on current and projected workforce gaps and evaluates the effectiveness of proposed interventions. 11. Role, focuses on the psychological well-being of healthcare professionals. Expertise, workplace stress management, resilience training, and mental health support systems. Contribution, develops initiatives to combat burnout and improve emotional health among nursing staff. 12. Role, handles messaging and outreach for campaigns to address the nursing shortage. Expertise, marketing strategies, public engagement, and media relations. Contribution, designs campaigns to attract new nurses, retain existing ones, and enhance the public image of nursing as a career. This team ensures a comprehensive approach to addressing the nursing shortage, balancing practical solutions with long-term strategies for systemic change. Brainstorming, 40 ideas, issues, or problems related to the nursing shortage. Workforce issues, high nurse-to-patient ratios compromising patient safety. Insufficient onboarding processes for newly hired nurses. Frequent burnout due to extended shifts and high stress. Limited career advancement opportunities within nursing. Increasing job dissatisfaction leading to high turnover rates. Aging nursing workforce nearing retirement. Lack of diversity in the nursing profession. Poor work-life balance leading to mental health issues. Uneven distribution of nurses, with shortages in rural and underserved areas. Inflexible scheduling systems that fail to accommodate nurses' personal needs. Educational challenges, shortage of nursing faculty in educational institutions. Limited capacity of nursing schools to admit students. Expensive tuition fees for nursing education. Inadequate clinical training opportunities for nursing students. Long wait lists for enrollment in nursing programs. Outdated curricula that fail to prepare nurses for modern healthcare challenges. Insufficient focus on mental health nursing and specialties and training programs. Barriers to continuing education for practicing nurses. Policy and regulation issues. Insufficient government funding for nursing education and training. Limited legislative support for safe staffing ratios. Inadequate protection against workplace violence in healthcare settings. Complex immigration policies that restrict international nurse recruitment. Lack of comprehensive policies for nurse retention. Limited reimbursement for healthcare organizations to employ adequate nursing staff. Bureaucratic hurdles for nurse licensing and certification across state or country borders. Compensation and benefits. Low wages compared to the workload and responsibility. Limited benefits such as paid leave, retirement plans, and childcare support. Disparities in pay and benefits between nurses in different healthcare settings. Lack of financial incentives for nurses pursuing specialized roles. Technological and operational challenges. Insufficient utilization of technology to reduce nurse workload. Lack of effective electronic health record (EHR) systems causing inefficiencies. Inadequate use of AI for predictive staffing and workload management. Over-reliance on manual scheduling systems. Limited access to telehealth resources for remote care, mental health, and workplace safety. High rates of physical and emotional violence against nurses. Insufficient mental health support programs for nurses. Stigma around seeking mental health care among healthcare workers. Frequent exposure to infectious diseases, including COVID-19, without adequate PPE. Workplace harassment and bullying from colleagues or supervisors. Perception and public awareness. Lack of public awareness about the critical role of nurses in healthcare systems. These ideas, issues, and problems highlight the multifaceted nature of the nursing shortage and the need for holistic solutions. Here's how each idea can be transcribed onto a separate index card or sticky note. Workforce issues, high nurse-to-patient ratios compromising patient safety. Insufficient onboarding processes for newly hired nurses. Frequent burnout due to extended shifts and high stress. Limited career advancement opportunities within nursing. Increasing job dissatisfaction leading to high turnover rates. Aging nursing workforce nearing retirement. Lack of diversity in the nursing profession. Poor work-life balance leading to mental health issues. Uneven distribution of nurses, with shortages in rural and underserved areas. Inflexible scheduling systems that fail to accommodate nurses' personal needs. educational challenges, shortage of nursing faculty in educational institutions, limited capacity of nursing schools to admit students, expensive tuition fees for nursing education, inadequate clinical training opportunities for nursing students, long wait list for enrollment in nursing programs, outdated curricula that fail to prepare nurses for modern healthcare challenges, insufficient focus on mental health nursing and specialties and training programs, barriers to continuing education for practicing nurses, policy and regulation issues, insufficient government funding for nursing education and training, limited legislative support for safe staffing ratios, inadequate protection against workplace violence in healthcare settings, complex immigration policies that restrict international nurse recruitment, lack of comprehensive policies for nurse retention, limited reimbursement for healthcare organizations to employ adequate nursing staff, bureaucratic hurdles for nurse licensing and certification across state or country borders, compensation and benefits, low wages compared to the workload and responsibility, limited benefits such as paid leave, retirement plans, and childcare support, disparities in pay and benefits between nurses in different healthcare settings, lack of financial incentives for nurses pursuing specialized roles, technological and operational challenges, insufficient utilization of technology to reduce nurse workload, lack of effective electronic health record (EHR) systems causing inefficiencies, inadequate use of AI for predictive staffing and workload management, over-reliance on manual scheduling systems, limited access to telehealth resources for remote care, mental health and workplace safety, high rates of physical and emotional violence against nurses, insufficient mental health support programs for nurses, stigma around seeking mental health care among healthcare workers, frequent exposure to infectious diseases, including COVID-19, without adequate PPE, workplace harassment and bullying from colleagues or supervisors, perception and public awareness, lack of public awareness about the critical role of nurses in healthcare systems. Each idea fits perfectly on its own index card or sticky note for brainstorming sessions, workshops, or visualization boards. Let me know if you'd like help organizing them further. To post all the index cards or sticky notes on a wall or board, imagine setting up the following process, as it would be done in a collaborative workshop or brainstorming session. Step-by-step visualization for posting cards. Preparation. Designate a board or wall. Use a large whiteboard, corkboard. To post all the index cards or sticky notes on a wall or board, imagine setting up the following process, as it would be done in a collaborative workshop or brainstorming session. Step-by-step visualization for posting cards. Preparation. Designate a board or wall. Use a large whiteboard, corkboard, or any blank wall space. Categorize by theme. Divide the board into 6 sections labeled workforce issues, educational challenges, policy and regulation issues, compensation and benefits, technological and operational challenges, mental health and workplace safety, perception and public awareness. Arrangement on the board. Workforce issues section. Post the 10 sticky notes, cards related to workforce problems under this section in a visually appealing grid. Align cards to highlight connections, e.g., place burnout near poor work-life balance for logical flow. Educational challenges section. Place the 8 sticky notes for education-related problems here. Group similar ideas together, such as those involving faculty shortages near limited student capacity. Policy and regulation issues section. Post the 7 notes related to policies under this category. Highlight connections, such as linking funding shortages to legislative barriers. Compensation and benefits section. Post 4 sticky notes cards here, ensuring visibility due to their focus scope. Group all compensation-related topics closely. Technological and operational challenges section. Arrange 5 sticky notes, cards for technological and operational ideas. Leave space for expanding upon solutions in future discussions. Mental health and workplace safety section. Post the 5 mental health and safety-related notes under this section. Ensure prominent placement as these are pressing concerns. Perception and public awareness section. Place the final sticky note about public perception prominently, possibly at the top of the board as a reminder of its overarching importance. Engagement suggestions. Use colored sticky notes for different categories, e.g. blue for workforce issues, green for policy, etc., to improve visual clarity. Provide markers and invite team members to draw connections, group similar themes, or annotate solutions directly on the board. Document the arrangement with a photo for digital sharing or further analysis. Would you like suggestions on facilitating a session using this setup? After moving and grouping similar ideas, the sticky notes cards can be organized into clusters based on their thematic overlap. Here's a structured list of the groups and their contents. 1. High nurse-to-patient ratios compromising patient safety, frequent burnout due to extended shifts and high stress, poor work-life balance leading to mental health issues, inflexible scheduling systems that fail to accommodate nurses' personal needs, uneven distribution of nurses with shortages in rural and underserved areas, increasing job dissatisfaction leading to high turnover rates. 2. Workforce planning and aging nursing workforce nearing retirement, limited career advancement opportunities within nursing, lack of diversity in the nursing profession, insufficient onboarding processes for newly hired nurses, limited benefits such as paid leave, retirement plans, and childcare support, low wages compared to the workload and responsibility, disparities in pay and benefits between nurses in different healthcare settings, lack of financial incentives for nurses pursuing specialized roles. 3. Shortage of nursing faculty in educational institutions, limited capacity of nursing schools to admit students, expensive tuition fees for nursing education, long wait lists for enrollment in nursing programs, outdated curricula that fail to prepare nurses for modern healthcare challenges, insufficient focus on mental health nursing and specialties and training programs, barriers to continuing education for practicing nurses, inadequate clinical training opportunities for nursing students. 4. Insufficient government funding for nursing education and training, limited legislative support for safe staffing ratios, bureaucratic hurdles for nurse licensing and certification across state or country borders, inadequate protection against workplace violence in healthcare settings, complex immigration policies that restrict international nurse recruitment, lack of comprehensive policies for nurse retention, limited reimbursement for healthcare organizations to employ adequate nursing staff. 5. Insufficient utilization of technology to reduce nurse workload, lack of effective electronic health record (EHR) systems causing inefficiencies, over-reliance on manual scheduling systems, inadequate use of AI for predictive staffing and workload management, limited access to telehealth resources for remote care. 6. High rates of physical and emotional violence against nurses, insufficient mental health support programs for nurses, stigma around seeking mental health care among healthcare workers, frequent exposure to infectious diseases, including COVID-19, without adequate PPE, workplace harassment and bullying from colleagues or supervisors. 7. Lack of public awareness about the critical role of nurses in healthcare systems. Optional engagement notes. Each group can now serve as a focus area for brainstorming potential solutions or further discussions. This organization ensures that related ideas are tackled together, promoting a more systematic and effective approach to addressing the nursing shortage. Would you like to prioritize or elaborate on solutions for any specific group? Analysis of patterns, priorities, and opportunities. Identified patterns, overlapping causes of burnout, high workloads, inflexible schedules, and unsafe work environments are interlinked, leading to burnout and job dissatisfaction. Bottlenecks in education. A limited number of educators and seats in nursing programs constrains the pipeline of new nurses, exacerbating shortages. Inequitable resource allocation. Urban areas tend to have better staffing compared to rural or underserved regions, creating disparities in healthcare delivery. Policy and regulation gaps. Existing policies fail to address systemic issues like staffing ratios, international recruitment barriers, and workplace violence. Underutilization of technology. Technological solutions that could ease operational burdens, e.g. AI scheduling EHRs, are not widely adopted. Inadequate focus on mental health. Nurses' mental health remains underserved despite its critical role in retention and productivity. Lack of public awareness. The undervaluation of nursing as a profession contributes to recruitment challenges and limited policy support. Key priorities. Alleviate workload-related stress, improve staffing ratios, and scheduling flexibility to reduce burnout. Expand the educational pipeline. Increase the capacity of nursing schools through funding and faculty development. Improve compensation and benefits. Align nurse pay and benefits with workload and responsibilities to attract and retain talent. Enhance workplace safety. Address violence and harassment issues with stronger policies and training programs. Adopt technology. Promote the use of EHRs, telehealth, and AI-based tools to streamline operations and reduce administrative burdens. Focus on retention. Develop incentives for nurses to remain in the profession, including pathways for career growth and mental health support. Strengthen advocacy and public image. Launch campaigns to raise awareness of the importance of nurses and encourage young people to enter the field. Opportunities for action. Pilot programs for flexible scheduling. Test systems that allow nurses to design their schedules within limits, reducing turnover and improving satisfaction. Scholarship programs. Partner with governments and private organizations to offer tuition support for nursing students. Incentivized faculty development. Create grants or loan forgiveness programs for individuals who become nursing educators. Digital workforce tools. Roll out AI-based workforce management tools to optimize staffing and predict shortages. Rural and underserved area outreach. Deploy mobile clinics staffed by traveling nurses to bridge gaps in underserved areas. Integrated mental health services. Embed mental health counselors and wellness programs into hospitals and clinics. Public campaigns. Develop media campaigns emphasizing the value of nursing and showcasing diverse career paths within the profession. Recommendations for further action. 1. Policy and advocacy. Collaborate with policymakers to pass laws mandating safe nurse-to-patient ratios. Advocate for increased funding for nursing schools and educator development. Establish nurse licensure compacts to facilitate interstate and international mobility. 2. Workforce and retention. Launch mentorship programs pairing experienced nurses with new hires. Design retention bonuses and professional growth tracks for specialized nursing roles. Offer flexible work arrangements to accommodate personal and family needs. 3. Educational reform. Increase grants to nursing schools to hire more faculty and expand class sizes. Incorporate mental health and workplace safety topics into nursing curricula. Partner with hospitals to provide hands-on clinical experiences for students. 4. Technology integration. Implement AI-driven scheduling systems to balance workloads efficiently. Promote the adoption of user-friendly EHR systems to reduce administrative tasks. Expand telehealth capabilities to serve rural populations and alleviate on-site workload. 5. Mental health and safety initiatives. Develop a robust system for reporting workplace violence and harassment. Provide wellness programs such as therapy sessions, yoga, and mindfulness workshops. Supply adequate PPE to protect nurses from infectious diseases. 6. Public awareness and recruitment. Work with media outlets to create inspiring stories about nurses' impact. Visit high schools and colleges to promote nursing careers and scholarship opportunities. Host open days at healthcare facilities to showcase modern nursing roles. 7. Immediate quick wins. Conduct a workforce survey to identify the most pressing issues in specific hospitals or regions. Set up an immediate fund to subsidize mental health services for nursing staff. Roll out a short-term advertising campaign highlighting nursing as a rewarding career. By addressing these patterns, focusing on priorities, and leveraging the outlined opportunities, the nursing shortage can be mitigated systematically. Would you like to explore one of these areas in more detail?
And that's the Affinity Diagram, a transformative tool for turning complexity into clarity. By brainstorming ideas, uncovering themes, and prioritizing actions, teams can navigate even the most overwhelming data to find actionable solutions. When paired with ChatGPT, the process becomes even more streamlined. AI helps identify patterns, refine themes, and generate insights, empowering teams to make smarter decisions faster. For more tools and techniques like this, check out the AI-powered Strategic Thinker 3.